says that the Institute of Medicine's Food and Nutrition Board in 1994 defined functional food as any food or food ingredient that may provide a health benefit beyond the traditional nutrients it contains. Sources of functional food: plant sources. Cancer's journal says it is now clear that there are components in a plant-based diet other than traditional nutrients that can reduce cancer risk. And according to Smith and Potter, they have identified more than a dozen classes of these biologically active plant chemicals, and they are now known as phytochemicals or plant chemicals that will be good for the health. But I will not talk about phytochemicals. It has been a topic here, paulit-ulit na. So I'll talk about animal functional foods. Animal sources. There is a number of physiologically active components in animal products that deserve attention for their potential role in optimal health, especially those which were before their consumption were prohibited or otherwise were limited by health practitioners. That means all these functional food were banned by health practitioners. Shocking. Now, first, conjugated linoleic acid. It was recently discovered that it is a very powerful tool against many diseases, including cancer. Conjugated linoleic acid, a stable component of milk fat. It's in the butter. It is in the cream. You don't find that in non-fat milk. So we're missing a lot. A very powerful natural anti-cancer, can suppress atherosclerosis, prevents aging, blocking, has antioxidative effects, shown to increase body protein and decrease body fat. It's good for obesity. Found mostly in animal products, dairy products. Number one, raw milk, butter, cheese, ghee. That is the Indian ghee, right? Clarified butter. These are the main source of CLA for humans. Red meat, particularly beef, is another major source. The meat of ruminants, those that chew, pass it to the stomach, then release it again, then pass it to another stomach. Ruminants, cows, sheep, and other animals that chew the cud contains more CLA than non-ruminants, like pork. Okay? Small amounts of conjugated linoleic acid have blocked all three stages of cancer. So, CLA will block initiation of cancer, promotion and growth of cancer, and metastasis of cancer. That can be blocked by CLA. But chemotherapy can only block one stage at a time, but CLA can do it simultaneously. So CLA, they said, is the most powerful anti-cancer from animal source. And where do you get that? You get that only from the belly, beef belly, from soft animal fat, from full cream milk, from buffalo. You don't get that from non-fat milk. CLA, which is rich in dairy products, raw milk, butter, cheese, ghee, yellow fat in red meat, and breast milk. That's why breast milk is one of the best tools against cancer. But in the Philippines, we don't sell breast milk. In America, they sell it. Animal studies show that as little as 0.5% CLA in your diet could reduce tumors by over 50%. So we are missing a lot. That is from 3 journals, journals of chemical biology and so on. Just recently published 2010. So that's why doctors do not know this yet. High cholesterol and triglycerides. What's the effect of CLA? CLA suppresses triglyceride accumulation and induces apoptosis in pre-adipocytes. So that means CLA can induce, even for cancer cells to commit suicide. For diabetes, CLA's action actually mimic the effect of synthetic diabetic drugs. Why? It maintains insulin sensitivity and non-inflammatory pattern in adipose tissue in mice. That means diabetic, they have insulin resistance, type 2 diabetes. If you give CLA, that resistance is lost. So it's very good for diabetic patients. Body composition, beneficial in lowering body fat, with even greater improvement in those who combine exercise with dietary intake of CLA. Significantly reduce body fat and increase lean body mass. That's from the American Journal of Clinical Nutrition. Inflammation, like arthritis, gout, and so on. That's why I give this to all my arthritic patients. CLA supplementation resulted in significant improvement in clinical manifestation of patients with rheumatoid arthritis. Oh, that's a tough disease. Very hard. But yet in my clinic, they're getting well because the diet is correct. Kidney disease. Wow. Dietary CLA decreased weight loss and extended survival following the onset of kidney failure in mice. So I use that extensively for kidney patients. Dietary CLA acid protects against end-stage disease of systemic lupus erythematosus. Cardiovascular disease, decreasing risk of cardiovascular diseases by improving cholesterol profile. For allergy, CLA showed anti-pruritic activity, yung Makate, okay? With significant inhibition of scratching behavior induced by compound 4880, a histamine release agent. That compound 4880 is the one that induces scratching. When painted onto the skin, CLA also inhibited compound 4880, platelet activating factor, protease-induced scratching behavior, and compound-induced vasodilation of the skin. Immunity. Compelling evidence is available which demonstrates the ability of CLA to modify soluble factors of mediators of immunity such as eicosanoid, prostaglandin, cytokines, and immunoglobulin production. Now let's look at another component of animal fat. Milk, raw milk, egg, and red meat. Okay, now egg is here. And red meat, high protein diet, you get branched-chain amino acid. Very important. You put your patient on high protein diet and you get excellent result. Okay. Branched-chain amino acids, BCAA, in diet improves insulin resistance and inhibits the activation of the IGF-IR axis. That means the insulin-like growth factor. What is this? Thereby preventing the development of colonic premalignancies associated with hyperlipidemia and hyperinsulinemia. For those who are diabetic and those who are obese, they are prone to cancer of the colon because of the IGF-IGFR. Where do you get IGF? You get that from growth hormone. Well, as the growth hormone travels to the liver, and with a very high insulin in the blood, insulin resistance, hyperinsulinemia, insulin converts, it stimulates the growth hormone to convert into IGF. Okay? It's a useful chemoprevention modality for colon cancer in obese people. So what's that useful? Red meat, egg, raw milk, whey. Dietary BCAA intervention could promote cognitive improvement by restoring hippocampal function after a traumatic brain injury. I have many patients. They had a fall, they became comatose. 5 days, 10 days under my care, they are awake in few minutes. And their diet is high CLA diet. You'll see that later. Could improve the dendritic cells function in cirrhotic patients. So it's good to regenerate the liver. Branched-chain amino acids, leucine, isoleucine, and valine, particularly leucine, are important factors in tissue growth and repair. BCAA have anabolic effects on protein metabolism by increasing the rate of protein synthesis and decreasing the rate of protein degradation in resting human muscle. Also, during recovery from endurance exercise, BCAAs were found to promote muscle recovery and reduces muscle soreness during exercise. So it's good for Manny Pacquiao. He needs a lot of CLA so that walang pain. No more pain, right? A study found that a decrease in BCAA, an increase in tyrosine, and the BCAA-tyrosine ratio in serum parallels the severity of hepatic parenchymal damage. So if you have patients with hepatitis, if you have patients with cancer, you have to give them foods high in branched-chain amino acids. And where do you get that high-protein diet? CLA promotes glucose uptake and is useful for prevention of progressive hepatic failure. Right. That's why you can see tomorrow, I'll present slides of patients which was already for liver transplant at UPPGH. He came to me. He was being asked $5 million. That was in 2007. He was a hopeless case. He was all yellow. He was scratching his back. He was a hopeless. He told me, I'm a teacher. I cannot afford to pay $5 million. So I treated him. In 2 months' time, he's back to work. You could see the slide tomorrow. Under my lecture, Rapid